medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Serum uric acid has been associated with an increased risk of cardiovascular and metabolic diseases in general. However, the causal mechanisms linking elevated uric acid levels to cardiometabolic diseases are still a little unsettled. One potential explanation for how uric acid might contribute to cardiometabolic disease might be its ability to induce systemic inflammation. And I think that's what I would like to discuss today. A positive relationship between serum uric acid and acute phase reactants has been seen. We see this relationship with high sensitive C-reactor protein, fibrinogen, ferritin, C3 complement, and erythrocyte sedimentation rate. And this was seen in a cohort of more than 2,700 non-diabetic adults. Now, the relationship remains significant, by the way, even after the adjustment for several confounders like age, sex, being overweight, antihypertensive treatments, or perhaps diuretics that may be in use. As you know, diuretics increase uric acid. So uric acid has been shown to have an ability to gain antioxidant properties by scavenging reactive oxygen species, as well as pro-oxidative properties by generating reactive oxygen species. Confused? You could be. Of interest, several studies have found that not only high, but also low uric acid were associated with an increased incidence of severe COVID-19 progression. In hyperuricemia, elevation of uric acid in the blood, reactive oxygen species are produced simultaneously with the formation of uric acid by something you might recall called xanthine oxidases. Intracellular uric acid has been reported to promote the production of reactive oxygen species. And the reactive oxygen species and the intracellular uric acid itself regulate several intracellular signaling pathways, and alterations in these pathways may result in the development of arteriosclerotic heart disease, coronary artery disease, basically. Of interest also, uric acid can also be generated in the GI tract because of the breakdown of nucleotides that are ingested either from the diet or from purines released from host as a result of pathogen-induced cell damage. Again, xanthine oxidase is the enzyme that converts hypoxanthine or xanthine into uric acid, a reaction that also generates the reactive oxygen species hydrogen peroxide. It has been assumed that the product of xanthine oxidase is responsible for the pro-inflammatory effects of this enzyme, which is hydrogen peroxide. And there's literature on uric acid that indicates that uric acid itself has been shown to have biological effects. It's been shown uric acid has detectable pro-inflammatory effects. In addition, white blood cells adhere very strongly to uric acid crystals, and they form large aggregates of cells. And uric acid acts as a leukocyte chemoattractant in the GI tract. Now, more than 30 to 40% of uric acid is excreted via the intestine. And the dysfunction of the intestinal epithelial, well, that's going to disrupt uric acid excretion. The involvement of the gut microbiota, which we talk about so much, in hyperuricemia has been reported in many studies previously as well. Hyperuricemia induces the expression of hepatic inflammatory molecules, which activate the nuclear factor kappa beta cascade. It's also associated with all those other inflammatory markers we talked about earlier. The pro-oxidative effects of uric acid also relate to copper, and it does by reducing copper, and of course when it does, it initiates lipid peroxidation. Uric acid increases alpha-tocopherol consumption, so vitamin E is. But there's one trick I give you on this presentation. The presence of nitric oxide which we've talked about before, you should be testing and utilizing, well, the presence of it completely inhibits the pro-oxidative activity of uric acid. In our next segment, we'll discuss potential causes, symptoms, and some of the natural treatments. And for more information, you can always contact me at www.drmitchghen.com. That's www.drmitchghen.com. Thank you so much for watching.